Is acceptable even in our government. If anyone dying of dengue, we have to go to national query, national level query if any deaths occur. So that's why dengue is so important in Malaysia. Anybody fever, first thing I think of is dengue. That's why sometimes doctors say hey, you have to take blood test. No lah doctor, I think it's normal fever. Most of the time it's normal fever. But if your luck is not good, it's a dengue and we miss the dengue, finish. There's no U-turn. So by taking a blood test, little bit of pain, I know it's a painful procedure, but it can save lot of other things, our complication. Okay? Because I'm in an emergency department, I've seen how the dengue can come. Sometimes dengue come with a low blood pressure, like you said earlier, very, very low. Okay, sometimes they come with a heart problem, they come with a liver problem, they are unable to breathe because what happens dengue when serious is your body vessels start having the leakage. When you start having leakage, your whole volume, the blood volume, the plasma will leak to all the body. So when leak to the body, so your vessel will have low volume, but your volume will be gone to the other part of your body. Let's say in the lung, it goes into the lung. Okay, in the abdomen, it goes to the abdomen. You can have the fluid outside the blood vessel, which we don't need. When you have the fluid outside the vessel, that means you are going to face another problem. So we shouldn't have this. So that's why we try to tackle when it's a day 1, day 2, day 3 fever, must take blood test. Doesn't matter whether you are taking in government hospital, clinic kesihatan or my best friend's clinic here. Okay, so anywhere, but you must take. It's not that doctor is simply asking you to take blood test. No such thing. Because of the problem we are facing in our ministry, when the problem occurs, that's the reason we advise public to do. So, when you have the dengue or something symptoms, I would like to tell you all what are the common symptoms you see when you have dengue. Normally high grade fever, okay, so up to day 3. Then subsequently you might have some loss of appetite. You won't have appetite to eat. Okay, then you might have vomiting, abdomen pain. Then worse is bleeding from nose, mouth, your urine, your motion, vomiting blood. This is serious really. Okay, the gum sometimes still, people acceptable, but still have to come and see doctor. What I'm saying acceptable is the gum sometimes, anybody brush teeth, normally they have bleeding. That sometimes is always there. It's not. So when you have during fever, also same gum bleeding, sometimes we give some excuse for them. Okay, I'll ask, my question will be, when you don't have fever, do you experience this problem? So you experience this problem and very commonly we see the bleeding from the gum, then I take it as normal. But when it's happening only during the fever, I'm worried. So something is not right. Okay, because we don't have many alarm systems here, we don't have a CCTV, anything to check what is wrong with our body. We have a simple alarms which tells you, oh, could be dengue, may not be dengue. Sometimes at our hospital level, for me it's very difficult to make decision whether dengue or not, because we have so other parameters which we can't discharge the patient, but patient is very comfortable. They say, I want to go back, doctor, nothing wrong. Doctor, don't over-exaggerate. I want to go home. Nothing will happen to me. But because of the clinical, whatever blood test we do, it doesn't show good. So that's why we advise them to admit. So it's not like simply we want to admit. Okay? And for most of us here, we know Klang gauge is saturated, fully, always no beds. Sometimes they have extension beds all down there. So, but still in dengue, we always make sure we take extra precaution to treat our people here. So please make sure, I think the system, government has started this fogging, all these things are very good. But basically I think our drains are still stagnant. So because of that, the mosquitoes are always can be there. Aedes aegypti, the mosquito, and the virus is dengue virus. So that's the reason we always, and the best treatment for the dengue is, if doctor say you got dengue but no need to admit, Make sure you drink lot of water. Water is the best treatment because you are supplementing whatever the fluid has lost from the body, you are replacing back. Okay? But if doctor said admit, please say, okay doctor, I'll admit. Don't argue. We don't argue. Okay? Agree? So, and even hospital, what we do, if the person unable to take fluid, we try to put intravenous line and we put the fluid into body. That's the best management for dengue. That's why government can't accept if people can die because of dengue. It's a simple treatment. We don't need high-tech antibiotic. We don't need the most expensive. We don't need the magic drug. Nothing we needed. All we need is fluid in our body, and that only we needed next 2 or 3 days. So after that, the day 3 onwards, you might not have the fever, but you are well. You feel well, but your appetite is still bad, poor. You look dry. You look like sick person, but there's no fever. That is very, very serious stage. No fever, you are active, you are doing your routine activity, your appetite is improved, no need to worry much. But no fever, but your appetite is not improved, you look sick. Why you look like sick person? You know, anyone in the family must be careful. Even though no fever, the dengue is actually dengue pattern, the fever pattern will go higher, stand one level. After some time, the whole immune system will come down. That's why the temperature will fall. So temperature fall is not always good sign. Most of the time it's a good sign because the child is active, child eating well, child doing a normal activity, the urine is normal, your appetite is improved. But sometimes your temperature come down, but your appetite is not improved. You're still vomiting. You still have little bit of blood, abdomen pain. These are things, dengue with warning sign, which we always admit. And at hospital level, doctors have certain other criteria to admit the patient. But as a layman, we should know which are the symptoms we should be alerted. Especially abdomen pain, vomiting, bleeding, breathing problem, or no temperature, but he looked dehydrated. Agreed? Understood? Okay. So any doubts on dengue, diabetes?